Hello, welcome to Kids Career Quest, and today we're excited to speak with Dr. Ken Grant, a pediatric gastroenterologist at CHOC Children's who helps kids with digestive and nutrition-related health issues. He works on new treatments, research studies, and ways to improve care for children with chronic conditions. He's received multiple awards for excellence in medicine and is recognized both locally and nationally for his work. Dr. Grant, thank you for joining us and sharing your experiences with Kids Career Quest.
Wow, it's my pleasure.
Moving on to the first question, what made you want to become a gastroenterologist? Was there something or someone who inspired you?
I think my focus and interest lay mostly in nutrition, growth, and development. When I put that all together, where my interests lie, that focused on kids, because those are the ones who are growing, and it focused on nutrition. And the gut is a very smart organ, but it's also really important for nutrition. And that's how I ended up in gastroenterology. There are a couple other things though. I'm good with my hands. I like doing things. I like fixing things. And so gastroenterology gave me the opportunity to do procedures and to see patients in the clinic and to see patients in the hospital. So it was a great breadth of what I could do with this career.
This is my partner, Matthew. He's going to ask you the next question.
Hello.
Hi, Matthew.
So it sounds really cool. Your field sounds really cool and specialized. Do you mind telling us what exactly you do as a gastroenterologist and what kinds of health problems do you help treat?
Sure. So in the pediatric world, you can tell that my bias is in nutrition, so I'm going to talk about that stuff first. Being able to eat, being able to swallow, being able to actually digest your food and to be able to poop is actually a very complicated process. The gastrointestinal tract has tons and tons of nerves and is actually a very smart organ in many ways. So the way food goes from the mouth all the way down through the stomach, the intestine, and out the butthole is a coordinated work of art in some ways. Every kid, no matter what other disease they have, needs to eat, needs to grow, needs to develop. So we're kind of almost like the primary specialist of specialists. It's a really cool place to be.
Wow. Yeah, following up on that, what does a typical day look like for you?
For our practice, we have a doctor assigned to the patients that are in the hospital and sick. We have a doctor assigned to the hospitals that we serve that are outside of CHOC. We call them the satellite hospitals. So think of UCI, Mission Viejo, Saddleback. There are any number of hospitals that we serve where there might be a sick child that needs our help. We have several doctors who are in the clinic seeing patients for their routine visits, or maybe not too routine visits. And we also have a little bit of time reserved for research, for education, for teaching, because we're a teaching hospital for the University of California, Irvine.
Yeah, and then can you share some examples of both treatments that you guys would perform for people who are afflicted or some lifestyle changes that those people can implement themselves that help keep them healthy?
If I think about the challenges of the day, it's probably obesity and people who are gaining weight too quickly. And for some of them, they can't really help it. There's genetic factors, there are environmental factors, where they're growing up, what food they have access to. But I think learning and teaching good eating habits, playing importance into the role of exercise and doing normal things in your life is absolutely critical. I think that if we could control some of the obesity problems, the future would be brighter for most patients, and I don't think that in the United States we're doing a terribly good job. And I always start with a patient who's new to me and talk to them about the Mediterranean diet, so that if one of your friends asks what's the best diet to be on right now, even if I'm a normal kid with a normal life and a normal medical history, a Mediterranean diet is a good guide. That doesn't mean you take away all the joy of eating, but the Mediterranean diet is a good guide.
So you mentioned stabilizers and thickeners in food. Are there any, can you mention some specific ingredients that are like huge red flags in food?
Yeah, there are several of them. I mean, I think if you think of lecithin, it's a Bermuda Triangle of words. Lecithin would be one of the things that I would think about. I think if you wanted to tell your friends how to do that, I think the easiest way is to say, if you're in the supermarket shopping and you're buying food that has probably been sitting on the shelf or is capable of sitting on the shelf for 2 years before you buy it and eat it, don't buy it. If it comes in a box or a can or a package and it's shaped, the food is shaped like the package, that probably also means that it's overly prepared and that there are thickeners and stabilizers in that food that you should be avoiding.
So a little bit of a fun question. What is the most common thing kids swallow that isn't food?
Coins. You know what the most dangerous things that kids swallow?
Maybe batteries, something to do with acidity.
Yep, so batteries, the button batteries, particularly if they're the larger ones, can be very dangerous. So a button battery the size of a quarter or bigger needs to be taken out very, very quickly in most circumstances. And the other is the little tiny magnets. And if you put several little tiny magnets, swallow them, and they separate, one magnet can be on one side of the intestine and another on the other side of the intestine. They don't move and they put pressure on the intestine and ultimately make a hole that can leak and make a child very, very sick. Some of those kids actually need surgery to get those magnets out of their intestine.
What's one of these patient stories or a project relating to this in your career that you're really proud of for doing good in someone's life?
You know, this past week, I'm a bit of an older doc here. This past week in clinic, I said goodbye to 3 of my patients. This is because they turned 21, and I'd known them, each and every one of them, since they were babies, when they were just born. And I think that it's so telling because they're really part of our family. They're part of my family. We've grown up together. I've supported them in some ways. They've taught, educated, and supported me. And I'm just so proud that I've been able to develop relationships with these families and these patients and have them want to come for their last visit and say goodbye, and that it's a tearful event. And I had like 3 really tearful events this past week, and just kind of glorious to stand there and take pictures with the patient for our memories. It was great.
Yeah, that's really touching. I'm sure that you're really proud of being able to foster those relationships. And then for our last question, what's one piece of advice that you would give kids who are interested in becoming a doctor or specializing in your field?
So this is just the general advice I give anyone who is thinking about becoming a doctor. You have to love to learn. If you love to learn, you're going to succeed. I'm old now and I learn every single day, and I'm inquisitive and ask questions every single day. And it's what makes every day different and what makes being a doctor special. And I learn something new every day. So love to learn. If you don't love to learn, if you're not inquisitive, you're probably not going to be a happy person being a doctor.
Alrighty, I think that wraps up our questions. So to conclude, thank you so much for taking the time to explain your profession to us. We are so grateful for the good that you do for the world and the lessons that you teach us. Your work has helped a lot of people, and we hope this inspires other people to make a difference like you too. So to commemorate your place in our interview series, we would love if you'd be able to sign a book that we'll eventually send in that we collected, and it's based on your field. Thank you so much for being a role model and showing us what it's like to be a gastroenterologist.
This was lots of fun. You're actually lucky that I didn't give you my little talk about burplets and fartlets. We'll do that another time.